So, day 2 of HBI 2022. Again, it's sunny in London. And I'm joined now by Gustavo Fodrini, who is the CEO and founder of the medicalized home care business, PalCare. Now, you operate in Argentina, in Ecuador, and recently established a presence in Colombia. Yeah. And I gather that when you were last at the HBI conference a few years ago, you were a speaker looking at what this whole sector might be. And then, of course, came the pandemic. Yes. Were your predictions right, or how ready were you for it?
Actually, for us, pandemic was another challenge because we were predicting other things for 2020. No one was waiting for the pandemic, but for us, represented other challenge because we are a company that has a task force that goes to the home of the patients. So when pandemic arrived, one insurance in one of our countries in Argentina asked us to come out with a creative solution or try to help them. They were facing the collapse of the system. So what we have done at that moment was to rent 3 hotels of the Wyndham chain in Buenos Aires. They were 240 beds. And we medicalized the hotels. We were accustomed to send doctors, nurses, kinesiologists, medicine to the home of the patients. And for us, we were very fast to take control of the hotels, put groups inside, define new protocols, and start receiving mild COVID patients. So we act as a buffer for the system. So we were looking for the alerts, checking the patients, and trying to decide if they stay in the hotel or we send to the hospital or to the emergency. And it was very successful, and for us it was. So we worked double during the pandemic. It was very interesting experience for us and very enriching as a company.
And you were absolutely spot on what was happening. So that experience must have been quite remarkable in terms of then helping people at home. What have you learned? What have you taken forward from that?
I learned that I have an excellent team because it was very difficult to work at that time. A lot of uncertainties. And people was really engaged in what we were doing. So we find it excellent. People at that moment that they came out that all of that it was needed to do. And the operational experience. We manage around now 1,200 patients per day in their homes. I will not say that it was easier to have 240 living at the same home, no, but because it was different. But we learned to adapt. That was the most important thing as an organization. As far as I see, home care is always thought as a small business or small thing and from big companies, even though it's growing. But I think there is a lot of opportunities in that kind of companies because they are, in my case, very flexible, very adaptable, very rapid to move. And after pandemic, I think there is a trend now to push the boundary of services towards the home of the patients. And now we are also adapting to that, and we created our own telehealth solution to monitor chronic patients at home.
What does that involve then? What exactly are you able to monitor with the telehealth?
We can monitor diabetics, blood pressure, COVID also. We have a combination of devices at home, no? Oximeter, tensiometer, glucometer. So we have defined different triage, different for each chronicity. So that device speaks to an application that works in iOS, Android, in a phone or a tablet. That application goes to our health operation center because we already have a health operation center. Now they are with phone. Now they have screens and checks and monitor the trigger, the alarm, and so on. So they can classify the state of the monitoring at that point and decide if it's an emergency or not and follow up. It's a following up solution. The difference that we have is that the provide an end-to-end solution because we provide the equipment, the software, and also the people that controls and manage the health operations center. It's all based in new technologies, develop and works in Amazon Web Services, database, everything complies with IPA. I'm getting technological. I'm sorry, I'm an electronic engineer. I'm not a doctor, but...
But there you go. So you're the electronic engineer. You know what you're doing. But what about those at home? My mother can't reply to an email.
Yeah.
How do you educate the patient to be technologically savvy enough to do this? And perhaps even some of the staff going in might need to be trained up in the technology. Not all experts like you.
Even though I'm electronic engineer, I think that the technology is not a mean by itself. It's a tool.
Yes.
No? So, we don't push. We're a technology company. Even though I hire engineers and developers, and I had to develop it from scratch because we develop it based on our own experience and our needs at home. But we also have the human factor, the people. So we still have the call center. So someone will call your mother, will explain. If she didn't take his measurements, someone will call her because we have different colors of alarms, no? In which if you have a bad numbers or probably you don't have you forgot to make the measurement, someone will call you and tell, please do it, explain. So the end-to-end solution means not only the devices, the cell phone, also means the people and the training and explain. And it's the idea is to solve the need. Today we do that, so we call people that has chronic disease because or people that, as you see, they are not accustomed to manage different things. But we have the people that do that.
End-to-end solution and adaptability. Well, thank you so much for those insights, Gustavo Fodrini.
Nice to
really
meet you.
interesting to meet you.
Nice
Thank you so much.
Thank you.